with us, we have Vice President of the designated hospital, Mr. Liu Cheng, Vice Party Secretary, and Mr. Li Xiangyu from the Information Office, and also the Mr. Duati from the Law Enforcement Department to give you the more details. First of all, I give the floor to Madame Shang Yulan to give you the information regarding the updated progress regarding COVID-19. Friends from the media, good afternoon. Now, first, I would like to give you the updated information about COVID-19 pandemic. As of yesterday, the newly confirmed COVID-19 cases stood at 111, 29 of which were developed from the asymptomatic carriers, and 0 new confirmed asymptomatic carriers. And we also have 3 patients discharged from the hospital, and we also have 5 people free from the medical observation, and 2 cases actually converted from the severe situation to normal situation. As of yesterday, 522 confirmed cases and 106 in Urumqi. From the 15th of July to the 30th of July, 9 patients discharged from the hospital, and we also have 9 asymptomatic carriers free from medical observation. Thank you. Thank you, Madame Shang Yulan, to give us the updated numbers regarding COVID-19 situation. And now is the Q&A session. Now the floor is open. Please identify your media outlet before raising questions. Thank you from Renmin News. And for our observation, right now we have seen the asymptomatic carriers, and also we have seen the patients free from the observation or discharged from hospitals. Would you please show us more information regarding the situation after they free from the observation and discharged from hospital? Now Mr. Liu Cheng will answer your question. Thank you. Friend from the media, so far, the discharged patients subject to the 7th edition of the COVID-19 treatment plan should all fulfill the requirements. First, they showed the negative results twice, and also the CT scan is showing the positive changes, and also the testing should have the interval of 24 hours in between, and the clinical modifications should all show positive changes. And also all these cases should be reviewed by the central COVID-19 leading group, as well as the leading group in Uyghur Autonomous Region. And they can be discharged from the hospital. And for asymptomatic carriers, we also have the guidance in place. And if they fulfill with all the requirements laid out in these requirements, and they are okay to be discharged or freed from the observation. And of course, they should also have the additional observation for the 14 days. And they also need to conduct a following up visit to the hospitals. And for the discharged patients, they should be reviewed based on their daily activities, as well as their CT scan and the respiratory observations. And for the normal and the mild symptom patients, they can start to do some light workout. And for the severe cases, for these patients, if they discharge from the hospitals and they need to get used to the normal life, And for these group of people, they need to, based on their conditions, to start to do some workout and also train on their strengths. Thank you, Mr. Liu Cheng. Thank you. From China Daily. Regarding the confirmed cases, how you categorize the patients, and we also have seen that some patients already improved their situation from severe to a normal symptoms. So what's our measures in this place? Thank you for your question. Now I invite Mr. Liu Cheng from the designated hospital to answer your question. For the confirmed patients of COVID-19, normally we divide them into 4 categories: the light symptoms and normal symptoms, severe and critical condition. So for the light or normal conditioned patients, they just show the symptoms like the fever or diarrhea or coughing, sneezing. And for the severe condition, they show the hypoglycemia condition. And for the critical conditions, they normally show the condition such as the DIC or the MODS, as well as the ARDS. So far, the treatment of the patients, we all follow the practice laid out at the 7th edition of the treatment released by the National Health Commission, and we closely focus on the healthy index, such as their blood condition, as well as their CRP, the blood urine results, as well as their liver condition, as well as the gas blood analysis, as well as their oxygenicity, and we'll also give them the high flow, the oxygen therapy, or the mechanical therapy. And for the critical patients, we also give them the antivirus medication, as well as the traditional Chinese medicine, as well as the ECMO or the invasive therapy, and we also to give the medications also included in the 7th edition. And so far we have seen that their CT scan, as well as the inflammatory index in their lungs, and also the symptoms all showed positive results. So far we have 12 patients in the critical or severe condition, all right now improved to the normal symptoms. Is it Xinjiang Daily News? The COVID-19 situation actually has imposed some difficulties to the sales of the agricultural products in the Urumqi or the surrounding places. What measures do we have in place to promote the sales? Thank you for your question. Now I would like to invite Mr. Li Xiangyu from the Agricultural Department to take your question. From January to July, we have 146,300 more for the agriculture products. And for the protein and the poultry, we also have the 40,000 tons. In order to expand the channels of sales and also fulfill the stable supply of markets, we also worked with the relevant departments to link the demand side with the supply side. We have done the following. So first, we organized specific teams to conduct the end-to-end review, so we know the full picture of the supply and demand side. So make sure that we can link the producing side to the demand side. And second, we also do everything we can to fulfill the market needs. And we organize the people locally, make sure that the immatured vegetables can be launched to the market as soon as possible. And we also give a more support to the poultry makers and also improve their capabilities. So far, the vegetables supply can reach 1,500 tons, and the poultry can reach 200 tons. For the large-scale vegetable wholesalers, as well as the supermarkets and the logistic companies, they all work together to bring the vegetables from the planting areas to the market. For the pigs, chicken, and mutton, and based on the market needs, will improve the number of meats available. And we also have the green channels available, make sure the logistic channel actually is unimpeded. So on top of that, in line with the epidemic prevention and control requirements for people involved in all these regards, and they already receive all the AT, and also they should practice the disinfectant behaviors every day. And we also conduct the samples examination, make sure that everything involved, that all clean and fulfill the requirements in the epidemic prevention and control requirement. Xinjiang network. Right now, we know actually the lockdown measures have imposed to the several communities. I would like to know how we can guarantee their daily necessity supply. Thank you for your question. Now I would like to invite Madam Xiang Yulan to answer your question. Since the outbreak of the epidemic, in order to cut off the transmission of the root of the virus, right now we practice the lockdown of the compound. In order to fulfill people's daily needs, we organize the departments involved in this regard, as well as volunteers, the workers in the communities, to conduct the body temperature checking, as well as environmental disinfectants. In addition, to fulfill people's daily needs is also part of their to-do list. So first, we help the residents to purchase their daily necessities. We also have created the WeChat group, so the residents can give their shopping list to the people or the officials in the group, so they can get the total needs in terms of the vegetables, the eggs, dairy, and medications, as well as the products for the mom and babies. So they will also to do the shoppings for the residents, and they also deliver to their door and in a contactless manner. Second, regarding emergency situation, the party members should play a leading role to solve the issues, especially the paying the utility bills, and also to deal with the garbages. And we also show the care to the people in terms of elderlies or the people living in financial difficulties. So vegetables, the cooking oils, the rice and powders actually will deliver to their home, and also for the anti-epidemic supplies will also freely provided. And for the laying patients or the patient need to do the dialysis, they also will deliver these group of people directly to the hospital or help them to buy the medications. So through the different chatting groups or making a phone call, we also to bring the information to the residents and also be patiently to answer their questions. And we also organize the experts to conduct a psychological counseling. By doing so, we help them to relieve the anxiety and they will be more cooperative to practice our epidemic prevention and control measures. On top of fulfilling their daily needs, for the people in difficulties, the 500 yuan equaled the products such as meats and delis will be delivered to this group of people. 11,826 people in 9,223 households actually benefited. And the mutton actually provided by the designated poultry makers and they delivered directly to these households. And the residents actually show their understanding and also give us great support to our work. So we will fulfill our responsibilities and provide the quality service to our residents. Thank you, Madam Shang Yulan. With Urumqi TV, and recently we talk about the law enforcement department actually deal with the cases regarding the fabricating or spreading the rumors. Thank you for your question. And now I would like to invite Mr. Mulati to take your question. Since the outbreak of the COVID-19 in Urumqi, our department has cooperated with relevant departments as well as the local government in order to lay a solid foundation to win the battle against the COVID-19. But we also found that certain people fabricated, spread the rumors, which caused the difficulties to win the battle. We received the phone call from the residents regarding the rumors. So one of the rumors actually regarding the false information regarding the NAT. Therefore, we dive into the details of this rumor and we had the reality check. Based on the 25th clause in the epidemic prevention and control law of PRC, and we punish the fabricating people with 500 RMB. Another rumor spread in the circle of WeChat regarding the large city-scale disinfectant of the water pipes. And we also actually clear up the rumors. This is a fake news. The water supply companies as well as the authorities conducted their practice subject to the national requirements in order to provide a safe, secure drinking water to the residents. And there is no information regarding the stopping water supply or the low quality water supply or the disinfectant behaviors. So also educated the people spreading these rumors. For people fabricating, spreading the rumors or the fake information or with any excuse or information that disturb the normal order of society, so these people will subject to the 25th clause of the punishment in respect to management of law and order for 25 to 50 days or the 500 RMB fine. For these people, they not just disturb the normal order of the society. For the severe ones, they will also subject to the critical laws. We once again call on everyone that cyber situation or the cyber security is also subject to the law enforcement. Do not make your own judgment fabricating the fake news. For anyone fabricating or spreading the rumors that will disturb the normal order of the social security, and the public security administration will bring them to the punishment. And we also call on everyone to observe themselves and behave, and also follow the law on public security administration and punishment, and should follow the requirements of COVID-19. Let's work together to win the battle against COVID-19. Thank you. Thank you very much. Friends from the media, ladies and gentlemen. The Information Office of the Government of Xinjiang Uygur Autonomous Region bring you this 14th press conference. And that's come to the end of our press conference. Thank you all the speakers, and thank you our friends from the media. Thank you all.